Help Wednesday for you now. August is National Breastfeeding Month, and it celebrates the benefits of breastfeeding and highlights the importance of building a supportive environment for breastfeeding moms and their babies. Dr. Laura Michaels is a board-certified breastfeeding and lactation medicine physician, and she joins us now with more on the advantages of breastfeeding and a specific reason some moms and babies may be struggling with breastfeeding. Dr. Michaels, thanks for coming back.
Thank you. Thank you for having me back. I really appreciate it, especially to celebrate World Breastfeeding Awareness Month.
We do need to do that. There's no question about it. We want to make sure people know how beneficial it is. And the first time we were here, there was just so much to get to because we know as much as you expect it to be something natural for moms, it can be tough for so many. And a lot of moms give up then, and we don't want that to happen. So this is where you come in. But before we get to some specifics about a particular obstacle, tell me first, just because it warrants repeating, some of the benefits of breastfeeding for moms and baby. And we can start with baby, if that's okay, and why it's so beneficial to them.
Yes, it's many benefits for baby.
Yeah.
And one of those is establishing the gut microbiome. One of those is reducing risk of SIDS, which is sudden infant death syndrome, and also promoting brain growth and development, as well as having a very healthy immune system by reducing allergies as well as infections.
They still call it liquid gold, don't they?
Yes, they do. Yes.
They do it for a reason. So for mom, there are benefits too. Let's chat about that.
So for mom, it actually reduces cardiovascular risk, cardiovascular disease, also type 2 diabetes, as well as osteoporosis, and as well as breast and ovarian cancer. Amazing.
So this is something that you definitely don't want to give up on.
No, you don't.
And yet we know so often women may turn to, and they're in the hospital, they have their baby, they're told, oh, you know, lactation consultant, and that may be enough. That may be enough. But if it's not, you offer something entirely different. So speak to me a little bit about what you can do beyond what a lactation consultant can do.
So as a breastfeeding medicine, lactation medicine physician, I can actually diagnose. I do an extensive assessment and history, as well as form a treatment plan for both mom and baby. I see moms and babies as patients. Each of them are my patient.
Right. So, okay, we talked before, and we encourage people to go to Women's Health and our community tab online, because we talked before about a lot of the different challenges moms and babies may have. We want to talk about one specific one this time, and that has to do with the tongue tie that the baby may have. So first, explain that for people and how you can resolve this and why it's a hindrance to breastfeeding.
Right, and it's a good example of how a breastfeeding lactation medicine physician can actually help with diagnosis of this particular issue that moms can have. And when a baby has a tongue tie, this can seem kind of simple, but it really causes a lot of discomfort in mothers. And when they have it basically is underneath the tongue and the lip, there's actually a line of tissue that can cause some issues, but it's really there for a reason. It's actually there to prevent any flapping of your tongue or your lip. And when there's any kind of restrictive movement, it can actually cause pain with breastfeeding and latch. And so it's super important to make sure that this restriction is not causing any problems.
So how do you resolve this? It's like that extra flap of skin making it very difficult, so there's a way to remove the tongue tie, right?
Yes. So one of the main reasons that moms come to see me is actually for latch pain.
Yep.
And there's many reasons that can cause latch pain. And one of those is positioning, which is simple by helping them learn how to breastfeed and to position their baby. Another one is you have tight muscles in the neck and the jaw. And another one could possibly be tongue tie, and that's causing a restriction and having latch pain. And a simple solution by helping them reposition, maybe see a physical therapist, and if they do need to have a tongue tie frenotomy, which is either done by either laser or scissors, and that is also done by either oral surgeons in the area. It can also be a pediatric ear, nose, and throat physician, and also pediatric oral surgeons in the area.
So you basically would send them to someone else, a professional, and they can remove that tongue tie so that they can get back to hopefully breastfeeding, and it won't be painful for mom, and it's beneficial to baby. And I know that obviously there's so much more we can talk about with regard to this.
Yes.
And I think we'll probably have you on again in the future. And I know there are some local experts, pediatric dentist Dr. Kotlow, that we're looking to have on as well to talk more about this. But this is a way that you can get back to something that is just so crucial for you and your child.
It is. It's very important for moms and babies to be comfortable in order to continue their breastfeeding journey.
So let me just real quick, where's your clinic so people know where to go to find you if they need help?
Yes, my clinic is called Dr. Laura Lee's Healthy Beginnings, Breastfeeding and Lactation Medicine. I'm located in Albany, and our website is www.dlhbbreastfeedingmed.com.
We'll make sure we have that online as well. Thank you so much for coming in again. Again, a lot more to unpack with regard to this. We're just scratching the surface, but we just want people to know that you're out there and they can get the help they need so they can hopefully breastfeed. Thanks, Dr. Michaels, for coming in again. For more resources, of course, and to find all of our Women's Health Wednesday segments online, go to news10.com. Look for Women's Health under the Community tab. We'll be right back.